Infection and sepsis are one of the leading causes of death in the United States. And what sepsis is the body's inflammatory response to an infection itself. If that remains untreated, you can go on to have brain damage and even die from sepsis. So when you have an infection, it's really important that doctors recognize that early and provide treatment before it progresses to something that is untreatable. It can result in a patient's death. We've seen all kinds of cases where someone gets infection that leads to sepsis. It can be something as simple as an insect bite. We've seen infected wounds like a pressure ulcer. We've seen pneumonia, urinary tract infections that lead to sepsis. We've seen joint infections or septic arthritis that leads to sepsis. The major red flags for sepsis are an infection combined with a high fever, an elevated respiratory rate, which means you're breathing heavy. Sometimes it's called dyspnea or shortness of breath, and tachycardia, which is an elevated heart rate. Not every patient who develops sepsis has the classic picture of sepsis. So some patients have other signs or symptoms such as a low oxygen saturation level. If you have coughing or you have signs or symptoms of pneumonia combined with any of the other things going on, such as a temperature, that should raise concerns. We've seen all types of cases involving infections that progress to sepsis. Some cases involve doctors or hospitals that do lab work, and the lab work comes back with indicators suggesting that the patient has sepsis, but they don't treat the patient or follow up on it. We've seen cases involving patients who go to see their doctor and they have a fever, shortness of breath, maybe a low oxygen saturation rate, and the doctor doesn't order simple imaging such as a chest x-ray or a CT scan of the chest to check for pneumonia. When we have clients that suffer injury from sepsis or infection, they can recover damages for a wrongful death if the sepsis goes on to cause a patient's death. They can recover damages for the medical care they required that was much more extensive than what they would have needed if the infection had been caught and treated early. And they can recover damages for life-changing injuries they suffered because of the infection that would have been avoided had it been treated early. Our firm is different from other firms when it comes to handling cases involving infection or sepsis because we've done so many of them. So that allows us to really isolate that case from the very beginning, from the first discussion with the client to understand what happened here and whether there's a case or not and how to move forward with their case. The first things we want to know are what were the very first signs of the infection and who did they see with concerns about those signs or symptoms. Did they get lab work done and what did the lab work show? Did they have any blood cultures done? So we want to get all of that data, and that will help us advise our clients about whether they had an infection, whether that should have been caught sooner, and if it had been caught sooner, would their outcome have been different?